Before a new medicine is made available to NHS patients in England and Wales, it has to be shown to be value for money. NICE, through its Technology Appraisal Programme, uses economic modelling to decide what is and isn't cost-effective, therefore determining many of the reimbursement decisions made by the NHS. With the world of medicine, medical research and technology advancing as never before, NICE is currently performing a methods review, looking into how it makes its recommendations and what could be improved. In these films, we will try to explain some of the key issues and what you can do to influence the review and ensure that your voice is heard. In this film, we're going to talk about disease management and care costs. When NICE is looking at whether a new treatment is cost-effective, they examine the benefits to patients versus its financial costs to the healthcare system. They not only look at the actual price of the treatment, but also the total costs of caring for the patient and managing their disease. However, in some cases, considering disease management and care costs for drugs that offer a clear survival improvement can cause issues around inequality. But what do we mean by this? Let's say, for example, that a new treatment, compared to what's currently available, grants you an additional 6 months of life, making a meaningful difference to you and your family. If the disease management and care costs are relatively low, just a matter of having some extra checkups with your GP, for example, then there will be no major implications for the overall decision by NICE about whether or not your new treatment is cost-effective. But the more complicated and costly your existing condition, the more likely it is that those costs will have major implications. If your treatment is for kidney disease, for example, you might also be required to continue having regular and expensive dialysis. Or if a new drug keeps you alive for longer than currently available treatment options but sees you spending your additional months in full-time care, then disease management and care costs can start to add up. There are some situations where, even if there is no cost associated with a new treatment, meaning that it costs nothing to the healthcare system, it will still not be seen as cost-effective by NICE because of high disease management and care costs, which would mean that you would be unlikely to be able to access it through the NHS. We believe this current system creates a barrier to access for new medications with high disease management and care costs. This, in turn, disincentivizes the development of new drugs for these kinds of conditions, leading to an inherent inequality for patients. In essence, if you are unlucky enough to have a disease with high management and care costs, then you are less likely to get access to new treatments that can prolong your life and the quality of it than someone who doesn't. While there has been some recognition of these issues, NICE hasn't yet made any changes to its methods to address them. Right now, however, we have a chance to change that, and that's why you should care about disease management and care costs, and help us to make sure this important topic is raised in discussions at the upcoming NICE Methods Review.